Hello and welcome to Snuggler Training. We are so happy that you have joined our team of 1,100 plus volunteers in the NCH healthcare system. We are even more excited to get you started in your volunteer role as a NICU snuggler. Our snugglers are special volunteers that provide support to our tiniest patients in the hospital and to our dedicated NICU staff. In this training, we will provide an overview of your role and responsibilities and prepare you for your hands-on training in the NICU. Due to the close patient contact that you have as a snuggler, you will participate in regular trainings to ensure the ongoing success of this volunteer program. We are joined today by Salita, one of our outstanding NICU educators. In a few moments, I will turn it over to Salita, but let's cover a few important points to ensure that you get the most out of today's session. The NCH Guest Relations Department is pleased to offer the Snuggler volunteer role to our community. If you ever have any questions or concerns regarding your volunteerism, please reach out to the NCH Guest Relationships leadership. We have offices at the North Naples and downtown campuses, and we are here to support you as you grow in your Snuggler volunteer role. You should have already received the Snuggler Volunteer Training Manual. Please follow along in your manual and jot down any questions that you have. We can address your questions during our hands-on training with our Snuggler preceptor. New snugglers are required to watch this training in its entirety. Please listen closely because you will need to jot down a code word that we will say during the presentation. Leadership will ask you for a code word prior to scheduling you for your hands-on training. And now I will hand it over to Salita.
Again, welcome to NCH Snuggler Program. I am Salita. I am the clinical educator for Women and Children's Division. Just a little bit about myself. I have been a NICU nurse for over 20 years and have implemented several of the Snuggler programs at different facilities throughout the state of Florida. We are so excited you have decided to come on and enjoy this ride of helping these precious infants grow and mature through their stay here at NCH with us. NCH Women and Children's Services include labor and delivery, mother-baby, our OB emergency service, our neonatal intensive care unit, our pediatric emergency department, and our pediatric inpatient unit, which is a PEDS PICU combination unit. Our neonatal intensive care unit is actually in a transition phase right now. We're currently at level 2, which cares for babies approximately 32 weeks and greater, but we're in the transition and moving to a level 3, for which we could handle all babies from viable state, which is around 22 weeks gestation and greater. This is going to be a phenomenal expansion for NCH Healthcare, and we're so excited for this transition and that you are here to help us through this process. A snuggler is a responsibility of a volunteer who is willing to come and give their time to show love and care for our very vulnerable patients in our neonatal intensive care. We're so excited that you have joined our team and be an essential part of the growth and development of these very precious infants. So some of our class objectives today. So we're going to talk about proper hand washing in the NICU. We're going to explain some of the equipment and processes that you may see in the NICU, which would include some of our feeding practices. We will explain to you how to swaddle and comfort a baby, how to change linen in a crib, and some of the safety and security that needs to be held accountable for in the NICU. So when you first enter the NICU, these patients are extremely vulnerable to different types of infections. So it's extremely important that we complete very specific and thorough hand washing. So everyone that enters the NICU are required to do a 3 to 5 minute scrub. This includes no jewelry on your hands, so no rings, no watches, no bracelets. And then you're going to scrub your hands for 3 to 5 minutes with a special soap and sponge that will be provided at every sink for you. After your initial scrub in of your 3 to 5 minutes, every time you touch a patient, you're going to use the alcohol gel before and after touching that baby. We're still in COVID protocol, so it's extremely important that all um, people in the NICU wear a level 3 mask when they're coming in contact with our patients. This is including our volunteer services, and you can find the mask in our NICU. Just ask the charge nurse at the front desk upon entering the NICU for a level 3 mask, and they will be more than willing to get one for you. As we talked about earlier, infection is extremely critical for our babies, so we want to make sure that everything is sterilized and clean that may come in contact with our patients and our hands. So we have a special cleaning device within the NICU that will actually sterilize your phone and watches, um, that will allow you to still be able to utilize them in the NICU if need be. Upon coming into the NICU, after you wash your hands and you switch over to your level 3 mask, the little device is located right beside the secretary's desk for sterilizing your phones and for the families. We highly encourage that the SNAP and our Snugglers encourage our families to sterilize their phones when entering in the NICU. Our phones are secondhand to us now. So parents like to take videos of their baby, take pictures of the baby, but what are on the phones? Tons and tons of bacteria. So ensuring that the phones are safe and sterilized so when they do come in contact with that patient is extremely important. So how can you, as the snuggler, assist the parents, but also assist the staff? This is some of the things we're going to talk about in the next few slides. Just a quick reminder, it is extremely important that you keep privacy when entering in the NICUs. You're going to hear information, you're going to hear the doctors rounding and giving reports, you're going to hear the nurses giving reports and talking about what's going on with these patients. And that patient sitting that you may be snuggling next to could be your neighbor. So privacy is extremely important to remember in regards to these families. Also, privacy within each family. Our unit is an open pod. That means there's no doors that separate one patient from the other. It's literally a curtain. So if I'm over there speaking to one family about their patient, the family next to us can obviously hear. So we try to provide as much privacy as we can for the families when we're discussing anything or when they're there visiting. If a family would come to you and ask you kind of how their baby's doing, I know it seems like a very um, easy answerable question, but for you guys, we refer you to go to the nurse or have the family go to the nurse to ask them for any information in regards to their patient. Only the nurses and doctors can give information to the parents about how their baby is doing. If a mother needs to breastfeed and you're looking for supplies, we have them supplies in the back of the unit. We have breastfeeding pillows, we use regular pillows, and we have them in that back corridor to be able to grab, and you'll learn what that is when you do your tour of the unit for them. We also have disposable covers that we place over them so there's no contamination if one mother uses our boppy pillow, for example, and then another mother needs to use it. So we use these disposable covers that are kept back there with our pillows. And feel free to be able to get them for them if they're asking for any type of supplies they need. Some of our babies in our unit is under what's called phototherapy. When I'm explaining this to a parent, I'm telling them it's like a tanning bed. Most everybody understands the philosophy of a tanning bed. When we go to the tanning bed, we require these special goggles over our eyes to protect our eyes while we're getting our nice little bronze tan in our tanning bed. Well, it's the same for the babies that are under phototherapy. So these babies are under this special light to take and break down what's called bilirubin. For more common knowledge, you've heard this called jaundice. So while they're under these very special lights to help with the breakdown of this bilirubin, that light can cause damage to their eyes, just like a tanning bed could cause damage to our eyes if we go tanning without these special goggles on. So we have special goggles for babies also. They're called Billy Mask. So if you see a baby that is in the bed and these masks have come off, you can ask the nurse, is it okay for you to take and readjust these masks? The goal is to make sure their eyes are completely covered when they move out of place. And I can tell you, they move out of place very often. There might be 3 or 4 times within an hour going to replace these back on the babies because they're like, I want to see, I can't see anything. So it's really important that, we help the nurses and keep these babies safe. The other thing you're going to see in our unit is different types of feeding. So there's different feeding skills and sets, and it has been determined that due to the difficulty of these babies that our snugglers will no longer be feeding our babies, and it will only be our NICU staff and or our parents feeding our babies. But there are things that you can do to help. They may ask about certain milks, they being able to grab a milk for them. They may be asking about different nipples and if you could grab a nipple for them, for the nurses. So we are going to still go over some of these items so you're familiar with them. It's extremely important that whomever is feeding these babies identify the correct feeding. Um, Idealistically, we try to promote breastfeeding for the majority of our infants or breast milk. So encouraging our moms to pump is very important for our NICU population because breast milk is the best for our infants. It provides higher nutrients and antibodies that we still haven't quite figured out how to get our formulas to be exactly like what moms can make for their babies. And babies tend to have either a minimum amount they need to take or a maximum amount they need to take. So not all babies can just drink whatever they want whenever they want. There are some that can, but the majority of them have a very specific quantity that they need to take. And when we're talking about these little babies, they don't feed very easily. It's extremely difficult to feed these babies. And one negative event can cause an infant to have what's called an oral aversion. And that's why babies just stop feeding. They'll turn away, they'll push away the bottle, they don't want anything in their mouth. And that's one thing we don't want for this population because they are so sensitive to have these oral aversions due to these negative events. And these oral aversions are long term complications for these babies. It's not like a week later they're going to be fixed and now they can bottle feed great. No, if they get an oral version, it could be years of therapy and training that these kids need to overcome this oral version. This is why feeding is very specific and making sure we have adequate and very educated staff to ensure these negative events do not occur. Our babies are allotted a very specific timeline for feeding. We give them only 30 minutes to feed. And the reason why we do that is because that after about 30 minutes, they're spending more calories on trying to eat than actually the calories that they're consuming. So if they're spending 45 minutes to eat and they were only getting 30 calories during that feeding, they probably spent probably 50 or 60 calories just trying to eat. So then they lost the amount of calories they would have had from that feeding. Now we're going to go into talking about the different type of nipples that we utilize in the NICU. So they are currently 4 different types of nipples that we use in the NICU, and each one has a very specific rationale why we use it. So we have a blue ring nipple, which is our standard nipple. Okay, when I talk about this nipple and I'm talking to a family about the type of nipple they would buy in a store, that is the same type of nipple that they would buy for a 3 to 6 month old. So it's like a level 1 nipple. Okay, we do not want our babies having that level 1 nipple because most of the time they cannot control the flow. It's coming out too fast, which could lead to choking and risk of aspiration for these babies. Our nipple of choice is this green ring nipple, which is called our slow flow nipple. This is like our level zeros out in the store or our newborn nipples. And it's a slower flow that most babies can handle. Then we have our purple nipple, which is our newer type of nipple, and that is called a super slow flow. Or sometimes you'll hear it called a preemie nipple. These nipples are used for our babies that are truly either really young and just starting feeding or having a lot of difficulty controlling the volume when they're taking a suck. The determination of which type of nipple is determined by either the occupational therapist or the nurse caring for that baby. And then we have our clear ring or our nook nipples. And again, that is just determined if the baby's having difficulty with the standard type of nipple, we'll turn over to a nook nipple, or if the baby is primarily breastfeeding, we may utilize the nook nipple. Sometimes our occupational therapists recommend certain bottles called the Dr. Brown's bottles. We do have some of these with our unit that we provide. Most of the time, we ask the families to provide these bottles. Some assistance you guys could give is cleaning, helping with the nurse clean these bottles and sterilization of these bottles. We have these little pouches that we place a little bit of water in, and after we rinse the bottles out and we wash them with soap and water, we'll stick all the parts of the bottle, which are a lot of them. There's the nipple, the ring, the inside cannulas, that has a top and the bottle. So it ends up about 6 or 7 different parts. And we stick them in this little bag. And then that bag has water in it. And then we stick that in the microwave for about a minute. And it actually sterilizes the bottles within this little pouch. The pouch can be used about 10 times before needing a new one. So we can sterilize a bottle 10 different times before needing a new one. Um, Sometimes we also ask the families to bring in the bottles that they're going to be using from home, especially if their babies are at the process of transitioning and probably going home within a week or so. And then again, we would do their bottles the same way as we do the Dr. Brown's. We would clean them and then sterilize them for reuse. As I spoke of earlier, our goal for all our babies within our NICU or within our organization period is to breastfeed. The golden standard for infant feeding is breastfeeding. This is because mom's milk provides so much nutrients and antibodies that we have not been able to establish in formulas correct yet. When moms come in to breastfeed their babies, we want to make sure they have privacy, they have the comfort they need, and if they need specific items or pillows or boppy pillows, that we provide them for them. We also want to ensure that mom is washing her hands or using the gel prior to feeding her baby. Again, parents are just like everybody else. As soon as they walk into our NICU, they have to do a 3-minute scrub. After a baby is fed, they should be held for about 5 to 10 minutes after the feeding. 99% of all babies have some type of reflux. Okay, this is just like you or I having acid reflux. It is not fun, it burns, it hurts. It also causes babies to spit up. So if we hold babies for about 5 to 10 minutes afterwards, even up to about 20 on some infants, it allows gravity to help work for that baby and keep that food down. And then when we lay the baby down, then they don't have these issues of refluxing. Refluxing could be very severe for these infants, depending on the severity of the reflux. I talked about the burning and aching and painful that it is, just like you or I having acid reflux, but also the acidic can actually cause babies to stop breathing. They'll hold their breath. Well, when the baby holds their breath, their heart rate drops. So, and that's very scary for a parent. So we want to make sure we're trying to eliminate that at all possible. But it also teaches the parents um, good technique for when they go home to hold their baby post feeding. Um, we want to give time for love and care and bonding with mom and baby, but there are times when our moms cannot be there. So these babies still need that loving and caring and bonding. And that's where you guys come in. Sometimes our nurses have 3, 4 patients and might not necessarily have the time. So they might feed the baby and say, hey, do you mind holding the baby after the feeding? And that's when then you would come in and then hold the baby until it was time to place the baby down. When we put babies down into our crib, we stick with the AAP standard of back to sleep. This is extremely important because we're setting guidelines for the families as well. Now, there are certain babies within our NICU that you will not be seeing placed on their back to sleep. They'll be placed on their belly, they'll be placed on their side. If an infant has any type of tube in them, then we elevate their head of the bed. So if I have a nasal gastric tube or a tube that goes in their nose down to their belly for feeding, or a tube that goes into their mouth down to their belly for feeding, this actually stents open our sphincter that's in between our esophagus and our stomach. Well, for us, we eat, the sphincter shuts down so our food don't come back up into our esophagus and we have this reflux, okay? Well, with babies, that muscle or the sphincter is not very strong. So it is easily stented open. So when they have a tube going down into that area, it actually keeps that little sphincter open. So after a baby eats, normally it would clamp down, but if it has a tube in it, it keeps it slightly dilated open, which allows that normal reflux to be even worse. So these babies you would see placed on their belly or on their side. Okay. However, our other babies should always be placed on their back if they don't have any type of tubes in. And this is standard to prevent SIDS. The next topic we're going to go into is how to swaddle a baby and why do we swaddle babies. So babies, when they're born, they're in this nice little warm environment inside mom. Their bodies are tucked in, so their hands are close to their face, tucked in, and their knees are usually tucked into their chest. That is a common position for all babies. So they love that swaddle feel. They love that tuck feel because that's what they've been used to inside mom. So we continue that while they're in the hospital stay with us. When we are providing their swaddle, we want to make sure certain things are in place. We want to make sure their hands and shoulders are in line and their hands are up towards their face, not placed alongside their body. We also want to make sure that our knees are kind of tucked in towards our belly. That gives them that secure feeling that they're looking for. So this is an illustration of how to swaddle. Again, you will go over this when you have your hands-on training. So you're going to take a blanket, a normal receiving blanket that we have on the unit, and you're going to put it in the diamond shape. At the top of the diamond, you're going to fold that first triangle down, and then we're going to lie the baby so their shoulders are at that triangle. Okay. Then we're going to take their hands and bring them up towards their face, and we're going to take one side of the blanket and then tuck it up under the opposite side of the body, as you see on picture C. On picture D, this one shows the hand down, but actually we want to make sure the hand is up towards their face, and then take and pull up the bottom area of the triangle, like in picture D. And the final step is taking the last triangle and pulling it over across the body and tucking it up under the baby, as you see in picture E, and then you have your final picture of F. This is how we swaddle infants. Again, remembering to keep their hands towards your mouth, because that is a natural, comforting position for a baby. All babies need the healing touch of a person. And I spoke earlier how some parents don't have the ability to come in, either due to transportation issues, due to mom still being in the hospital and extremely sick. Whatever the reason is, these babies still need to have that love and touch and comfort. And that's where you guys come in so much for us. If our parents are not able to be there to hold and comfort these babies, just having that extra warm body to come over and give them a smile, talk to them, hold them, let these babies know that they're not there alone. It's extremely important for their healing process to feel that love and comfort feeling from a person. This is extremely important for our babies that has neonatal abstinence syndrome. You'll hear us call it NAS. So these are babies that have been, mom was taking some type of drugs during her pregnancy. So when the babies are born, they still are addicted to the medications that mom were taking or the illicit drugs that mom was taking. So now they're having withdrawal side effects from these medications. These children, these babies are very sensitive. Over here, just the picture is showing you different signs, and I'll go through them in a second. But there's different techniques that we use with these babies to help comfort them. Okay, we utilize a scoring system called a Finnegan scoring system. It looks at the different signs of withdrawal for infants and then establishes a number. Then we look at another technique called eat, sleep, and console. We're utilizing both of these kind of hand in hand right now, primarily using the Finnegan scoring, but also implementing some of the eat, sleep, console processes to prevent the need of excessive amount of narcotics. So if a baby is withdrawing from something they were exposed to in utero, we have to treat it with a medication if they're having severe withdrawals from that. And our medication of choice is morphine that we use here at NCH. So some of the signs of a baby withdrawing. So it could be as simple as yawning, sneezing. So if a baby yawns or sneezes more than 3 times in a row, you need to let the nurse know. Why is that so important? It's just a yawn. Oh, the baby's tired. Well, actually, it is a sign of withdrawal. And 3 times in a row actually gives that baby a point when that nurse is doing their scoring. The way the baby looks, their color is called mottled. They have like white spotting on them. If the baby is wanting to suck, they're just rooting all over the place and trying to suck on everything. That is another sign of withdrawing. It's called excessive sucking. These babies tend to have a high-pitched cry, and it is an excruciating cry. And you'll understand what I mean the first time you ever hear it. It's not a normal baby cry. Their cry is like, I'm in pain. I need help. So You will notice that with these kids. And then they may have elevated temperatures, and they may have tremors or shaking when you're messing with them. And these are normal signs of what we would expect to see with a baby going through neonatal abstinence syndrome. They are also all the signs that we look at when we're doing their scoring. So anytime you are holding these babies and you're seeing these signs, just let the nurse know so she can be vigilant on ensuring this baby's getting a proper score. Before I go into snuggling safely, I am going to talk a little bit more about the neonatal abstinence babies and some of the things that we can kind of do to kind of help with the withdrawal process. I mentioned earlier about Eat, Sleep, Console. This is a new initiative that we're doing here at NCH. And what it does is utilizes babies' natural instincts of things that they need. Like babies need to be held, they need to be loved, they need to be rocked. So if we can provide that versus giving them medication to help ease the withdrawal, that's a better practice. Also, these babies need to eat pretty frequently. They're not like some of the other babies within the NICU that'll go 3 to 4 hours to eat. They may want to eat every hour sometimes, and that's okay. So, feeding them when they need to feed and then comforting when they need to be comforted is going to help through this withdrawal process. That's where this new initiative, Eat, Sleep, Console, comes in. We want to make sure we're comforting these babies when they need to be comforted and then feeding them when they need to feed and providing that love and comfort for them to get through this very harsh process. Snuggling safely. So, when you're there to provide any type of care for these babies, especially hold them, we want to make sure we're in a good chair that has the ability to be locked. So you don't want to sit down and the chair roll out from under you, right? We want to make sure you're sitting safely with these babies secure in your arms. You also want to be pretty close to the crib. You don't want to have the chair on the other side of the little area and you're having a hard time getting back over to a crib. One, these babies tend to have wires all over them. They're going to have leads. They're going to have their pulse socks on. And we don't take these off of these babies until they're ready to go home. So being able to manipulate the wires and being close to that monitor so you're not far away is important also. You want to make sure you have clean hands. I know you're going to hear me talk about cleaning your hands this entire video. That is how important it is. So when you're going over there to do anything, you're hitting the alcohol swab to clean your hands prior to it. You're going to make sure or washing your hands. About every 3 to 5 times I use the alcohol cleanser, I need to go and wash my hands because it can put a film on your hands. So just as a reminder, use one or the other before and after touching these babies. You want to pick up these babies and pull them tightly against your chest so you have a good hold of them. You want to make sure you have control of their head and their body. You want to be careful that you are aware of your surroundings. There could be wires, there could be different type of equipment all around that bedside. You want to make sure you're not tripping over anything when you're getting around. We try to keep it very cluster free. However, there are times that these babies have a lot of equipment near their bedside for whatever reason or the other. So just be cautious of surroundings and making sure you're safely moving from your crib to the baby to the chair where you're going to be sitting with the baby. Another item you guys are going to be doing is maybe initially setting up our bassinets is what we call them. There are little cribs. There's several different types of beds we use in the NICU. This is just one of the types that we use. So one of the things that our snugglers do is make sure they use our Calvi wipes to wipe down these beds if it's needing to be cleaned, or if it looks, sometimes they've been sitting there for a while and they're just dusty. We want to make sure we have them nice and clean. And then we set up the bed. So to set up the bed, we usually use a pillowcase for the mattress and then a couple receiving blankets for the bed. Another task you guys tend to help with is folding and stocking some of our supplies. So we have several different types of supplies within our NICU. We have regular receiving blankets, we have our little t-shirts, our little onesies. Um, we have our sleeper gowns, and then we have regular baby clothes as well. And then we have our specialty equipment for our babies, which is called our developmental equipment. So you may be helping fold any of them as they come in from laundry. Um, our stocking area for our blankets and our washcloths and our baby t-shirts are in the back side of the NICU in our little supply room area. Our specialty linen are throughout the unit and our carts marked as developmental equipment. And then we have some marked for boy clothes and girl clothes, and they are scattered throughout the entire unit. It's extremely important that we keep our babies safe. Babies in the NICU do not necessarily have infant security tags like they would if they were up on mother baby. So it's important we know who comes in and out of our unit at all times. So if someone walks in the unit and you don't know who they are, it's okay to ask, hey, how can I help you? You know, pretty much, what are you doing here without saying, what are you doing here? Because it's important we know who is coming in and out of that unit. Also, babies have a band. Most of them will either have it on their bed or they will have it on one of their extremities, either their hand or their arms or their leg. And it has an ID number on it. When mom comes in, that ID number should be the exact same as baby's. Again, it talks about a GPS monitoring. That is our hugs tag that we have here at NCH. And there's only going to be very few babies in the NICU that have this tag on. The majority of our babies will not, due to they're in different types of beds. Um, we want to make sure that we are not allowing people to come into NICU or any of our secured areas within women and children behind us. It's called piggybacking. So if you go out to the parking garage to go to your car and come back in, and you're coming in down through the sky bridge to enter into the Women and Children's Pavilion, you want to make sure no one follows behind you. Them doors do have a lag, so sometimes I have to stand there for a couple of seconds to make sure they completely close before I walk away, that no one follows me in. Same as if you're going out any of our doors to exit out of the facility besides the front entrance. Um, they also tend to have a lag for a second, so you want to make sure you stay there and monitor before you walk away that no one comes in there after you. And the last thing I want to go over is called Code Pink. Code Pink is our drill and our security abduction system that we utilize at NCH. If we find a baby that is not where it's supposed to be, or if one of our security tags go off, our hex tags system goes off, then we lock down the unit and we call a code pink. Okay. During the code pink, is extremely important for our snugglers to stay in place and wait for instructions for our staff. They may want you just to stay right there with the baby because as the staff, they have special techniques that they have to do. They, one, have to make accountability for all the patients within the NICU, and then they have to man all the doors. There has to be someone at the doors coming in and out of the NICU in both locations, as well as some of our front entrances into and out of our Women and Children's Pavilion. And we want to be alert and vigilant of anybody that may be walking around that should not be there during this security mode. So if it was a truly an abduction of a baby and we seen somebody with a bag, we might say, "Hey, can I help you? Like, what's going on? What do you need?" You're not going to stop that person, but you are definitely going to try to talk to them to get them to stop. If you see something suspicious, you want to speak up and say something. If you see someone within the Women and Children's Pavilion without a pink badge on or a badge period, you want to speak up about it, especially if they have no badge on and in scrubs.
We want to thank Salida for offering her time today to help us uh, ensure our volunteer snugglers have a good understanding of their role and responsibilities as NICU snugglers. Salida, like so many of our nursing staff, are very well versed in the care and treatment that they're providing to these babies, and they're always happy to support you in your snuggler volunteer position. We want to take a few minutes to go over some important information regarding your volunteer role. As you can recall from your volunteer orientation, we went through a lot of information regarding confidentiality and privacy. Of course, we are so proud of our volunteers and your contributions to our mission at NCH. But just remember that everything that you learn while you're volunteering must stay within the walls of our healthcare system. This is especially important when we're talking about our patients. Even though these are tiny babies, they still have their right to privacy, and their families expect that we will adhere to all of the rules and protocols surrounding patient confidentiality. So just remember that it is your responsibility to only communicate information that is required for your position at NCH. This is referred to as need to know. That means that we share information on a need to know basis. Uh, for us as volunteers, this means that we can't go home and share information about the patients that we're caring for with members of our family, with people within our church or our neighborhood. We have to make sure that that stays within the walls of the hospital. When we think about some of the patients, especially those NAS babies that we're taking care of, some of those babies are going through very difficult things. And you might have an instinct or you might want to share that information with someone, but we need to refrain from doing that, especially when it comes to things like maybe talking about their parents or things that you may have observed in the NICU. Just remember that oversharing can lead to privacy breaches. Additionally, we want to make sure that you are never taking any pictures of yourself, computer screens, patients, or coworkers, even if you're requested by a patient or family to do so. So this is something that we see just with having our phones accessible to us at all times. We know that people are always wanting to take pictures of themselves, especially take pictures with these sweet babies. But as volunteers, we cannot do that. If a family asks you to take a photo, we would just ask that you politely decline and say, "Oh, you can ask the nurse to do that for you," or just within my volunteer role, I unfortunately cannot do that. And then, of course, we never share our volunteer experiences on social media at a chance of breaching someone's patient privacy. You should not be posting any photos or stories or anything that you learn in the NICU on social media. At this time, we want you to write down your code word. This is going to be required for you to be connected to our Snuggler preceptor who will do your training. And the code word is tiny baby. So please write down tiny baby and you're going to report that to the volunteer manager. Snugglers are our awesome team members. We really appreciate your service in the NICU, and our staff really appreciates it as well. So we want to give you a few tips to ensure a very positive experience while you're volunteering. Our snugglers get to know our nurses very well. In fact, they even get together from time to time And we want to make sure that you have a positive experience from the very start. So just remember that when you start in your volunteer role, you want to visit all of the nursing staff and all the clinical techs and our patient service representatives that sit at the main desk. And you want to introduce yourself by name and tell them who you are and what shift you're going to be working. And you want to get to know their names as well because you will be working very closely together and sharing information with each other. One of our volunteers, I always appreciate her efforts with our staff. She goes around and she visits all of the staff before she even starts her shift, before she even holds a baby. She goes around and she checks on all of our nurses to make sure that they don't need anything, whether it's, a glass of water or a cup of coffee, before she gets started. And I think that that's a really outstanding touch as a volunteer, because she's able to just help them address their needs. We know how hard our nursing staff is working, and sometimes they don't always get breaks or take breaks for themselves, especially when they have a sick baby. So, looking out for our clinical caregivers is so important when it comes to your volunteer role. Always speak up and ask for opportunities to help. Volunteers can proactively find areas to stock, organize, clean, and maintain. This is something that we recommend with all of our volunteer positions. Sometimes staff don't know how to ask for help, but if they see that you're actively getting involved, if you're taking the initiative to wipe down chairs, to fold linens and stock supplies for them, they'll probably be more apt to get you involved and offer, opportunities for you to hold the babies while you're in the NICU. And then always remember to wear gloves and use when you're using our sanitizing cloths. Those sanitizing cloths do contain a lot of harmful agents, and we want to make sure that there is a barrier between you and the cloth. When you come in to volunteer, it is very important that you record your time on your volunteer time card. We have a special area, as you can see pictured here, for our snugglers to store their personal belongings and record their time. So this provides some instruction. It's in multi-purpose room 1345. And when you receive your tour of the NICU, we will show you that and we will show you how to gain access to those lockers. But when in one of the lockers, we maintain all of the snugglers' time cards. And how this works is you go in and you fill out how many hours you work for every shift that you volunteer, and then we record your time in our database. It is very important to record your time for many different reasons, but we do need to have a record of who is working and which day you're working. Additionally, it allows us to provide volunteer meal cards to you, and it allows us to thank you and recognize you during Volunteer Appreciation Week. If you know that you're going to be away and you'll be unable to volunteer because you're taking a vacation, you can always reach out to our Snuggler substitutes. We have a few volunteers that only substitute, and so we want to reach out to them first and schedule people to fill in for you on your shift. If for some reason you wake up and you're sick in the morning and you cannot come into your volunteer shift, please don't feel pressure to find a substitute. If you do have a friend who's a snuggler who can fill in for you, that's great, and you can send that person as long as they're approved to volunteer with us in the snuggler role. But you can also just call the NICU and let them know that you're sick, that you're not feeling well, and that you can't come in. If you even have the slightest tickle in your throat, we would ask you not to come in because we want to ensure that we're not passing anything along to these little babies. So it's very important that we're always monitoring our health before we come in to the NICU and making sure that we're feeling 100% healthy before we start volunteering. We are very happy to have a snuggler preceptor. A preceptor is an experienced snuggler volunteer who assists as a mentor and will help provide your training. She will provide a tour to you, introduce you to our staff. She's going to orient you to the role and explain frequently used equipment and supplies, providing hands-on demonstrations in hand washing and snuggling, and then determine when you can work your shift independently. So she may sit with you several times to ensure that you have a good handle on your volunteer role. For this snuggler position, you have the closest patient contact of any role that we offer within our volunteer program. And so we do require ongoing training for our snuggler volunteers. We'll typically have an annual training session for you. But then know that our NICU nursing staff and our snuggler preceptor provide regular feedback to us to ensure that you're competent and serving to the best of your ability. And then they will also identify areas where you may need to improve as far as holding babies, rocking babies, and then just assisting with overall general tasks within the NICU. And as always, you can always find support within the NCH Guest Relations Department. There are some ongoing snuggler requirements that we want you to be aware of. Of course, maintaining your vaccinations is a top priority for us because, again, these babies are highly susceptible to picking up infections, and we want to make sure that we're not passing anything along to them. So you will need to submit proof of your annual flu shot to the volunteer office. You do this every year. Typically, it's in the fall between the months of August and December. And we want you to submit that every year to us. We also want you to provide dates of any additional COVID boosters that you receive. Having a COVID vaccine is a requirement of volunteering, and then any boosters that you receive, we're required to report that to the CDC. Volunteers who serve in the NICU are required to have a Tdap shot. That's for whooping cough and pertussis, because we know those babies are again susceptible to picking that up. So you can go to our employee medical center to have your Tdap shot, and we do ask for you to have that done every 10 years. And we will send reminders to you about all of these things when they are due to our office. We will send out an annual training, and we send that out for all volunteers. Everyone who serves in any department within the healthcare system is required to complete annual education. But then we also offer additional snugglers trainings to ensure that you are up to date on all of the skills, all of the protocols, and all of the procedures. Our role as a snuggler volunteer requires that you are in good physical and mental health for the role, and we will ask you to complete a snuggler medical clearance form every 2 years. We want you to have this form reviewed and signed off by a physician, and then remember that it is your responsibility to notify our volunteer office if there are any changes to your physical or mental health. At times, we have volunteers that do need to take a leave of absence, and that's fine. We completely understand that, but we just want to communicate that with the volunteer office, and remember that you will most likely have to have a physician sign off before you can return to your volunteer position. And of course, if you ever wish to make any permanent changes to your volunteer schedule or to your volunteer service area, always contact the guest relations office. We've got the number provided here as well as our email address, and we're always happy to provide support to you. Thank you so much for participating in this training today. We appreciate you and the service that you will provide to our tiniest and most vulnerable patients. And a member of our team will be in touch with you soon. Happy snuggling.